There comes a time when we all have to make difficult decisions, like how our older loved ones are going to be cared for when they can no longer properly care for themselves. And that's especially true when memory begins to fail. Karra Weil, Regional Director of Clinical Services for Browning Masonic Community, joins us with some options this morning. Good morning. Thanks for joining us today.
Good morning.
First of all, let's talk about Browning Masonic Community and the types of services that you offer.
So Browning has 3 different types of living areas for residents. We have independent living, which does not have clinical support. They're villa apartments. Then we have assisted living for people that need some minimal assistance. And then we have our memory care, which is our locked dementia care unit that has trained dementia staff that help people with dementia thrive.
Let's talk a little bit about that. And I've had some experience with this in my family, and it's such a hard thing, when somebody you love starts to lose their memory. So what are some signs that relatives and caregivers should be looking for that, their loved one might need a little extra care?
So I would tell you, if you had anyone who is under physician care for an Alzheimer dementia diagnosis, or someone who is starting to lose their daily routine and start to question, well, I already did that, or did I do that? Those types of things, it's time to maybe talk to a physician and have a cognitive assessment.
Yeah, there might be those things where you're like, you've never had a problem doing that before, but all of a sudden,
right,
this is becoming an issue. So, let's talk more about this dementia care program and what people can expect with it. What do you guys offer there?
So our program is unique because what we do is we connect someone's past to where they are now. So we really do a good job at finding out, like, what do they do for a living? What are they passionate about in life? What are the things that they really enjoy doing? And then we figure out, where are they at now? What are their cognitive abilities? Not what they can't do, but what can they do? And then we connect them both into resident-centered care.
It's just wonderful to see, making those connections for them and giving them activities to do that they really love. Because as I mentioned, it is so heartbreaking to see folks when they begin to lose their memory or sense of who they are. And for you to be able to continue to connect them to that is just really wonderful and special, and probably helps, loved ones, caretakers feel a little bit better as well. So if somebody says, what, this sounds like me, I've got a family member, I need to get some more information, how do they get in contact with you guys?
They can contact us by our website or the phone number that's listed on the screen.
Yep, you can go ahead and jot that down. You have the address there. You guys are in Waterville, correct?
Yes.
Yeah, so go ahead, give them a call, learn some more information. Karra, we really do want to, hope for our loved ones to, end their lives, in a respectful way. So really special, some of the things that you guys are able to provide for them. There's that phone number if you want to go ahead and jot that down. Karra, thanks so much for joining us this morning. We appreciate it.
Thank you.
Yep, take care.